Hey, Dr. Blair, so the topic I decided to choose was actually tapeworms. I've always had a fear of tapeworms. I did off work, so just kind of bear with me. By the way, you cannot use this video for any future reference because I look atrocious, if we're being honest. So tapeworms are long flat worms that attach to, if it's in a dog or cat, will attach into their intestines, so therefore they are an intestinal parasite. Their body is divided up into segments, and they have reproductive organs, of course. They will enter their human host and humans can ingest tapeworms by ingesting contaminated food, contaminated water. It can also be that humans can also get it from animals. So that being said, usually you want to make sure your meat is cooked thoroughly. Don't want to be undercooked. If it's undercooked, you could very well get tapeworms. So I personally have always had a fear of tapeworms. Don't ever want to have one, and would like for my meat to be cooked well done all the time. I'd rather be a little well done or a little burnt instead of undercooked. So one, contaminated food, or tapeworms are usually more consumed in places that have high consumption of raw fish, like freshwater fish, such as like Eastern Europe, maybe the Scandinavian area, Japan. I mean, they have sushi, which kind of sucks now because my boyfriend has gotten hooked on sushi. So, yay. So, but when tapeworms are passed from an animal to human, it's called zoonosis. When someone has a tapeworm, treatment usually is pretty effective. I mean, if it's done right, that is. It can be completed in a few days, but you still would have to go every month or two after having tapeworms and after medication has been taken thoroughly and completely. A human would have to have their stools checked to make sure that they don't have any remaining tapeworms. Usually, a person can ingest tapeworms by eating their eggs. So if they ingest the eggs will go down into the gut or the stomach area. The larvae will hatch, or the eggs will hatch and produce larvae. The larvae can then either stay in the gut or spread to different areas. Usually an adult tapeworm can live for about 20 years. They can get about 50 feet long, which you have something like that living inside your body. And I looked at some pictures of tapeworms. It's just very disturbing and very disgusting. Like, no, I don't want that inside me. So, dwarf tapeworm is actually a type of tapeworm that my research, it was the only type of tapeworm that can be consumed, or that can be, not consumed, but can be transferred from human to human. Let's see. One second. Usually if someone has a tapeworm, they may or may not have some symptoms, but if they were to have some symptoms, they could be having, apparently most people who so on the websites I looked at, most people who have tapeworms don't usually know it. Which, if something is like 50 feet long and living inside of me, I honestly would like to know and would like to have it taken care of. So some of the symptoms a person could have if they have a tapeworm would be abdominal pain. They have nausea, vomiting. What else? Abdominal pain. There could be evidence. Number one way would probably be having evidence in their stools or feces, whichever word you want to use. Nausea. They could have general weakness, malnutrition, maybe rapid weight loss, difficulty sleeping, an altered appetite, or maybe a decrease in appetite. You could also have the inflammation of intestines, diarrhea, so maybe even convulsions. A couple of different types of tapeworms. I have no idea how to say these words, so I'm just going to hold it up and try to pronounce it. This one right here, I don't know if you can see it or not, but Tinea solium, I butcher words, I cannot pronounce to save my life. That would be a tapeworm that would be ingested if someone were to eat undercooked or raw pork. You have Tinea yeah, I can't pronounce that. There's another one right underneath there. Yeah, that one. If someone were to ingest undercooked or raw beef. Then you have dwarf tapeworm, and that I think is the actual name for it, the Latin name, genus, species type of thing. Yeah. And there's this one right here that actually is for type of tapeworm that a human can have from ingesting freshwater fish that is, of course, raw or undercooked. And of course, humans are not the only ones who can have tapeworms. Also, dogs and cats can get it. There's this one type right here called Diphylidium canadium. That one right there. I don't know how to pronounce it, but dogs that get that type of tapeworm actually can get it from fleas. From the tapeworm will actually be using the fleas as hosts, and once they get on the fleas get on the dogs can get tapeworms. That's one way they can get it. Another one is this one right here. Once again, I don't know how to pronounce this, okay. Tinea and Echinococcus, maybe. I don't exactly know. Or I can't exactly pronounce this, save my life, for being honest. So, but they can get that from, the Tinea would be by rodents. And then the other one, the Echinococcus, if that's how you say it right, I don't really know, would be from large animals like deer or sheep. So, okay, for humans that would have tapeworms, they do have some complications, and I found a couple of names for some of them that would have complications, or what the name of the complications would be with tapeworms. So there's one that's called cysticercosis. That's how it's spelled. It would be when a human actually would ingest tapeworms, or not tapeworms, but the eggs or larvae from pork or undercooked contaminated pork. They would actually have cysts that could swell up, or hang on a second. So that's this one right here is where a human would ingest actual pork tapeworm eggs, or would ingest eggs from pork, and the the eggs would actually go out of either the intestines or the gut and actually spread to other organs in the body and form cysts and would form cysts. Okay, there's this other one called neurocysticercosis. That one right there. Neurocysticercosis. However you say it. It would affect the nervous system and the brain. So with that being said, once again, it also comes from pork tapeworms, and if it's affecting your brain and your nervous system, you can have headaches. A person can have headaches, confusion, meningitis, maybe seizures. Some very, 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 very severe cases, it can be very fatal, which would not be good. And this last one called hydatid disease, I think that's how you say it, I don't really know, but it's also called that bird right there, the Echinococcus, I don't know. but it would also, it's one that would actually go out and infect the organs. The larvae would actually go out into the human body and would infect different organs, and would actually it would form cysts it would form cysts that would affect different blood vessels, and when it put pressure on the blood vessels, it could also cut off circulations. They tend to sometimes go towards mainly the liver, and so if it gets to the liver, needless to say, that's not good, because you're going to be needing a liver transplant. So yeah, not good. But usually with tapeworms, the treatment wise would be that you'd be taking oral medication. I mean, treatment's pretty easy. I mean, it seems pretty simple to take care of, but at the same time, I would, once again, not want something like that long living inside me. So, yeah, no. Of course, there are ways to prevent tapeworms. You can have, use good sanitation when you're preparing food. Make sure your food's cooked all the way through, which is a good reason why I chose this topic, because I got Bojangles, freaking fast food. So make sure the food's cooked all the right way, or cooked the right way, cooked and temped at the right temperature. Make sure you're not cross-contaminating food or different surfaces. Make sure the area's cleaned up straight, good hygiene, all that good stuff.